Gastroesophageal reflux disorder is a very common complaint and also the common ailments in our eastern world, basically India and Asian countries. Due to there is a different causes of about it. So first I just give you significant points which we have to obey in our common life so that we can prevent the GERD. So basically GERD from the scientific point of view, the main cause is increased TLESR. This is so what is the TLESR? It's the transient relaxation of the lower esophageal sphincter. This is a almost documented reason cause behind the GERD. So this is our esophagus and stomach which are connected. At this point there is some sphincter which commonly control our food input and food regurgitation. So this area when becomes ineffective or not going to work properly, when there is no sphincter is not working at that stage, when then if the stomach is loaded in our any persons, so there may be regurgitation or some upward vomiting or regurgitation is in that case is very common. So in for this reason we have to obey some rules regulation and to maintain our dietary regulation and to maintain some lifestyle changes. This is very important for the GERD. So our common complaint is the heartburn. That is basically burning sensation in the retrosternal chest. So what is this burning sensation? It can mimic with some cardiac disorder, but in that case there is some same complaint is there. In that case, when food going to regurgitate, there is some burning acid reflux in our retrosternal region. In that case, we are feeling some burning pain. So people are commonly for the patient point of view, patient are commonly saying some retrosternal chest pain is there. So in that case, we have to do some investigation so that we can diagnose the GERD or some reflux disorder. So first, one of the main thing is there is patient food habits. This is a very important point. So if the food containing some spicy material and some fatty material or some irritating materials, so in that case there may be acid juice or acid bath is overloading. In that case acid reflux is very common. And another point is taking the fatty meal. Fatty meal, when a normal peristaltic movement in our system is the 4 to 6 hours. When we take any food, it will take time to 4 to 6 hours to clean from the stomach to duodenum. This is the common incidence. When we take the fatty meal or some high food containing the spicy ingredient, in that case the peristaltic movement goes to slows down. So in that case 8 to 10 hours is required for the clearance in the stomach. So whole the stomach get overloaded, and if we not going to properly maintain the next food schedule, so there is a chance of reflux is very common. And in that reflux containing some acid bath and acid juice which burns the lower esophageal sphincter and also the lower 1/3 of the esophagus, which is for the reason there is some ulceration or erosion or early stage of Barrett's esophagus may be chance of incidence. So that we have to very cautious of our food habits and also the lifestyle changes. What is the lifestyle changes? We have to quit if there is any addiction, because alcohol is a very common causes for the acid regurgitation. If you take the alcohol and there is some irritation from the juice, release the acid juice in the stomach, and that can be reflux is there. So alcohol is one of the causes for the GERD. Smoking is also because smoking impairs the lower esophageal sphincter relaxation, and in that case there may be regurgitation. Now smoking, alcohol, spicy diet, fatty material, you have to quit from your system or regular lifestyle. Another point is very important. You take the food in specific interval very routinely, because if you take the breakfast, if you take the lunch, if you take the dinner, it should be very scheduled. It can skip by half an hour to 1 hour, but it never be skipped or can be omitted by any means. because if your diet schedule is not there, your timing if it's not there, if there is maybe overloading, and also the intestinal peristaltic movement is not working properly. This is very important part. Another some common causes is there. If there is the biliary problem, if any patient suffering from liver disease, if any suffering from biliary dyskinesia, if any patient suffering from other cirrhotic changes or any liver disease, in that case what is the problem? Some bile reflux may be there. This is called the biliary reflux. This is very common in basically alcoholic liver disease case, when the alkaline juice, basically the biliary bile, is comes in the stomach, and the antrum and the lower part of the stomach and get bucked by the alkaline juice, which is not fitted for the environment. So in that case, if we go for the alkaline juice, and these alkaline juice causes or hampers the forward movements of the stomach, so that there is the backloading and the reflux may be there. This is one of the point. And another point is the obesity, because you have to control your weights by activities or yoga or regular work exercise. You have to maintain your BMI because obesity is one of the reasons, because if obese patient, there is the intra-abdominal pressure is going to very high. When there is intra-abdominal pressure is high, stomach is very much compressed, and there is reflux, chances of reflux is very common in that case of obesity. So you have to maintain your weight by every your activity changes your lifestyle is very important. Another point is the lower GI disorder. If your outlet is not clear, because if there is some lower GI disorder because of habitual constipation or constipation, so this is the actual intestine is not clearing from the lower end, so that your back reflux may be there. This is the very late complication of GIRD basically. So if you are a chronic constipated, if your colon is not cleared, if your sigmoid colon is not cleared properly, so you have to take care of the lower GI tract, because your stool should be cleared every day. That should be very formed stool should be there, and also there is no incidence of any digestive disorder, because if the lower end, if the outlet is not going to clear properly, there is a high chances of reflux disorder, and people may suffer from these types of problem. And this is the major causes I have discussed to everything, and from the away from the normal reasons, normal conditions of the I have already discussed. There is some different metabolic reasons which can also causes the GIRD. They like scleroderma is one of the disease, and also the hypothyroidism is one of the disease, and some diabetic patient, and because diabetic type 2 there is associated with obesity, there's a chances of reflux disorder is very common. So this is we have to conscious about the points, and we have to maintain like this. Now the medication, this is very important. If there is a continuous GIRD, what is the problem we are facing in our life? If the patient is suffering from the GIRD or reflux disorder or any heartburn, so the first choice is the antacid, instant relief. Patient comes to the doctor. We are treating these types of patient regularly. Patient comes to us for the complaint of these types of complaint. This is the first line of management to give the relief of the patient instantly. Give you some antacid combination with some antiflatulent property. It will relieve the GIRD, because there is the neutralize the pH, and patient can be symptomatic relief. But this is using the patient at your home site. Very commonly take the medicines from the outside medicine shop and take the antacid, but this is not fair. Basically you should go to the proper doctor, and you have to consult with your gastroenterologist, so that your treatment and your advice should be very rational and very perfect. So, so though there is antacid is the first line of choice, next line of choice is the PPI. This is very common. We are using proton pump inhibitor, which causes the acid suppression from the stomach level at the receptor level. This is very important. And also some motility, for this motility disorders, we have to use the prokinetics. There are lots of prokinetics in our hand. Basically we are using previously metoclopramide and also mozapride, and now we are using etopride, levosulfuride, domperidone. All of the very good property, and different types of patient are using different types of prokinetics we are prescribing. There are lots of medication in our hand, and lots of pharma industries has come with the very good quality of product, we are using these types of products for the benefit of the GRD. The first is the prokinetic is very important, and one is the second is the PPI is very important. PPI, lots of PPI in our hand. Now we are using rabeprazole, esomeprazole, elaprazole. These types of PPI is very common and very safe drug, so that it can improve the patient's condition. And also antacid should be your hand. If there is any acute problem, you should use the antacid definitely. And also some cytoprotective medication is also in our hand. We are using sometimes the sucralfate is a very good product. If we use it causes some patient relief, and some cytoprotection is there. It increases the mucin secretion, and also patient relief is very common in that cases. This is some medications we are using commonly. If there is nausea, we are sometimes use the ondansetron, sometimes use the ranisetron. This is all the medication using. And if you have some lower GI disorder, you should be aware about it. Your constipation should be very clear. Stool should be very regularized. This is a very important part. And what is your activities you should prevent from your side. This is the physical activity is very important. Your sedentary habits should be omitted. You should be very active. You should be regular walking is important. Your yoga is important. Your weight should be reduced. Your obesity should be controlled. Your diet restrictions is very important. Your basically fat free diet should be taken, and the diabetic patient, diabetes should be under control. Metformin should be there to reduce the weight. And also if there is obesity, you go for the early stat is very important for the lipase inhibitor. You should reduce your weight from your side. And we are the doctors, hope you should be better for your life, rest of the life, because GRD is one of the complaint. Late complication is there also, because this ultimately goes to the biliary esophagus, and ultimately esophageal carcinoma, which is very common. And for this reason patient can die within a very short span of time. So you don't ignore the GRD, you don't ignore the reflux disorder. This is not a simple thing. You take the medication from your local medical shop and take your medicine, you get relief. This is not fair. You should go for the proper medical advice to the doctors, to the renowned doctors or the gastroenterologist. You should obey the instructions and take the medication, and take the maintain your lifestyle. And also take some you should quit your addiction level also. This is very important part. And I hope for the better life and better health, and early treatment and early